Good evening, everybody. My name is Evangeline Borja, and I was not able to attend class tonight, so I will be presenting on my own. I'm in the group along with Baljit, Jamin, and Amanda, and we decided to present on emerging, or our title of our presentation is called Emerging Innovations in Nursing and Healthcare Delivery. What factors are influencing and driving change in the way patient care is delivered? There are many factors that are influencing and driving change in the way patient care is delivered. These factors would include rising patient populations, severity of patient illnesses, demographics, culture, rising healthcare costs, accessibility, and patient cooperation. These factors, due to these factors, there is a need for innovation. What is innovation? According to the ANA, innovation is the design, invention, development, and or implementation of a new or altered products, services, systems, organizational structures, or business models for the purpose of creating new value for customers and financial returns for the firm. So the innovation that we wanted to present was electronic health records. Big innovation, right? Everyone knows that back in the past, a patient's a patient's records would be on paper, not electronic. So pretty much, I could just think of a doctor, a nurse coming by doing rounds, and when they would check up on you, it would be a clipboard with a bunch of papers at the bedside, and that's how they would present. So the healthcare innovation that we decided was electronic health records. According to healthit.gov, an electronic health record is a digital version of a patient's paper chart. Electronic health records are real-time patient-centered records that make information available instantly and securely to authorized users. Now, we wanted to show a short clip of what an electronic health record is.
Every time a new patient is admitted to hospital, a new medical record is created. The medical record documents relevant information about the patient during their stay. It forms the legal record of care provided and is essential for clinical communication. When the patient is discharged, the medical record is sent to the hospital coders, who take the information and convert it into code. These codes are then used to identify trends and patterns of disease, improve the safety and quality of care, and to determine the cost of providing that care, so that the health services receive the appropriate funding. An incomplete or ambiguous medical record can lead to inaccurate coding. Due to strict coding rules, coders cannot make assumptions about diagnoses, procedures, medications, and complications. If the medical record is unclear, hospitals and their patients can miss out on the funding they're entitled to. If it isn't clearly written down, it didn't happen. To avoid this, clinicians should ensure that clinical notes are complete, legible, and updated in a timely manner, are as specific as possible, and use only commonly accepted abbreviations and terminology. clearly document the principal diagnosis as well as any additional diagnoses and identify all diagnostic and therapeutic interventions. Clinical notes should provide clear links between symptoms, medications, and treatments provided. In the case of complications, clearly documenting when the condition began, whether a complication was present on admission or arose during the episode of care. This will ensure that not only the next clinician, but coders, researchers and planners can take this information and use it to its full potential. Because a healthy medical record, clear, complete and coded, will not only improve outcomes for every Australian patient, but our healthcare system as well. The clearer the record, the brighter our future.
Okay. So, yes, that is what an electronic health record is. What a time it is to be a healthcare worker where we have access to electronic health records, right? It could take long to find a bunch of documents or files that you're looking for on a patient, but now it's just at a click of a button. That is, unless there is some sort of technical issues going on, but we'll get to that later. Here are the advantages of electronic health records. According to healthit.gov, the advantages of electronic health records are providing accurate, up-to-date, and complete information about patients at the point of care. It enables quick access to patient records, reduces medical errors to provide safer care, that's a big one, improves care coordination with healthcare staff, promotes legible and more accurate documentation, that's another big one, and reduces costs due to decreased paperwork. Some disadvantages of electronic health records. Electronic health records would be effective. According to Gallagher Healthcare, the disadvantages of electronic health records are staff resistance to change, staff that is not tech savvy, and potential privacy and security issues. Electronic health records effectivity in the workplace. Electronic health records would be effective in all healthcare settings. Unfortunately, not all facilities have implemented this innovation due to lack of finances, awareness, and administrative support. For example, many skilled nursing facilities have yet to adopt the electronic health record. Baljeet was telling our group that she works in a skilled nursing facility that's they still have paper charting in place. They don't have, it's not fully electronic yet. And she said she feels that paper charting is very slow, and a lot of times the handwriting is illegible. They take more time trying to figure out and decipher what the doctor or somebody wrote. It could be very frustrating. Another example is sometimes when a doctor or healthcare provider comes in and they write an order for a patient, whether it could be a medication order or a treatment order, and the nurse might forget to thoroughly complete and carry out the order. Due to the written nature of the healthcare record at Baljeet's skilled nursing facility where she works at. And so she also mentioned that she wished that the administrator would invest in electronic health records and put it into effect, because there would be way less medication errors, and the staff would be up to date with the latest technology. Nurse leader as a change agent. According to Marquise and Huston, a nurse leader is responsible for focusing on group process, information gathering, feedback, empowering others, and emphasizing interpersonal relationships. They also define change agent as a person skilled in the theory and implementation of planned change. Stages of change and responsibilities of the change agent. According to Marquise and Huston, there are 3 stages of change. So, stage 1, the first stage is unfreezing. In this stage, the change agent must gather data, diagnose the problem, decide if change is needed, and bring awareness to staff about need for a change. The second stage would be movement. In this stage, the change agent must develop a plan, set goals, identify areas of support or resistance, set target dates, develop strategies, implement the change, evaluate the change, and modify if necessary. The third stage would be refreezing. So in this stage, we want to maintain the change and make sure it stays that way. Financial concerns to implementing new technology. One financial concern to implementing new technology is budget approval. In order to ensure a smooth financial process, the nurse must incorporate the nursing process ADPI to adequately prepare for budget planning and approval. Financial concerns to implementing new technology. Another financial concern to implementing new technology is choosing an appropriate budget method. The budget method we think would be effective for the implementation of the electronic health records would be flexible budgeting. According to Marquise and Huston, flexible budgets are budgets that flex up and down over the year depending on volume. A flexible budget automatically calculates what the expenses should be, given the volume that is occurring. In conclusion, our emerging innovation in nursing and healthcare delivery was the electronic health record. In order for electronic health records to be implemented in healthcare, there must be a change agent, motivated employees, collaboration, and budget planning. And here are our references. Thank you.